Meningitis is inflammation of the meninges, and the meninges is the lining of the brain and the spinal cord. So if you think about it, it's two of our most valuable organs. And when the lining gets inflamed, regardless of the reason, whether it's an infection or an inflammatory disorder, it can cause pretty severe neurological consequences and can even actually cause death. So when the lining gets inflamed, most commonly people will present with symptoms like a high fever, a stiff neck, because that lining is, getting thicker and stiffer. They can have headaches. They can have confusion, because if that inflammation starts to progress, it can push on the brain, cause nausea, vomiting, and cause confusion or changes in mental status. And then because it's involved in our nerves, we can also have increased sensitivity to light. So if you see the constellation of those symptoms, fever, stiff neck, and confusion, along with some of the others I mentioned, you really, really want to have a high suspicion for something like meningitis. It can be either. In fact, you can also get meningitis from fungus. You can get it from parasites. You can get it from tuberculosis. You can even get it from cancer. You can get it from autoimmune conditions. So there's a variety of different types of things that can cause inflammation of the meninges, the lining of the brain and the spinal cord. And the treatment really depends on kind of what the underlying cause is. So one of the things we like to do very early in the course of meningitis is a lumbar puncture or a spinal tap, where you actually look at that fluid under a microscope, and that gives you clues as to what the cause of that inflammation is. So it tells you whether there's bacteria in it, there's certain types of bacteria fighting cells, there's viruses, and then you can tailor the treatment. So if it's a bacterial organism, you generally, of course, want to use antibiotics as opposed to a viral, where you might want to think about an antiviral agent. Often they will also add steroids, because steroids help sort of suppress some of that inflammation and some of the neurological consequences. But early treatment is incredibly important in terms of determining the prognosis, especially if it's bacterial meningitis, because that can be, fatal within a day. So if you have any suspicion for whether or not it is meningitis, sometimes we'll often initiate treatment alongside the diagnostic workup. You want to be a little careful about giving antibiotics before you've done that LP with a big gap in time, because then it could sterilize your LP and sort of make you lose the clues. But oftentimes we'll drip in the antibiotics as we're doing the lumbar puncture, so that we can have, the treatment alongside with the diagnostic workup. We're still starting to get clues about exactly what happened in these cases, whether it really was meningitis or something else. And if so, how did the teachers actually contract meningitis? If you think about meningitis, it's pretty rare, bacterial meningitis, but we can have an incidence of about 1.3 cases per 100,000. So we do see it from time to time. And I remember when I was a resident at Brigham and Women's Hospital, and I was taking call in the ICU, almost every call, somebody would come in with a rule out meningitis or a concern for meningitis. So I don't think that these two particular teachers in Colorado are necessarily alarming. But having said that, if they were both diagnosed with meningitis and they work in sort of the same school district, the contact tracing and the people that they may have come into contact with is very important. And for this reason, the Colorado Department of Public Health actually gave prophylactic or preventive antibiotics to many of their possible exposures, their students. Now, the way meningitis is transmitted, it generally requires, more prolonged contact. Casual contact doesn't cause it to spread as efficiently as conditions like coronavirus or the flu, which are generally much more contagious. But it spreads in much the same way through some of those respiratory secretions, those droplets, kissing, close contact, coughing, sharing utensils, those types of things can certainly help to spread it. There are some subsets of meningitis that are actually spread through contaminated food as well. Again, it's unclear exactly what these two teachers had, which organism was involved in their meningitis or presumed meningitis illness. But that might actually be something that the public health department wants to explore as well, in terms of determining where they got it from. So it's brought meningitis to the forefront for us to think about. It's made us think about prevention of meningitis, which I think is critically important. But I don't think it's an alarming public health emergency that they were diagnosed. I would say a couple things. First, of course, protect yourself. So if you have somebody with fever, stiff neck, altered mental status, photophobia, nausea, vomiting, that's the classic signs and symptoms. You just want to presume that they have meningitis, and we want to mask up and make sure you're having full respiratory precautions. But the second and most importantly is that early diagnosis and treatment. It's never wrong to pull a false alarm when it comes to meningitis. And if they have an LP and it turns out, that they just have a severe migraine, or they have, some other type of sinus infection or something else, great. But you don't want to delay getting that lumbar puncture done. You don't want to delay starting that empiric antibiotic therapy until you're sure, because even with treatment, 10 to 15% of patients will have, significant life-threatening complications or death resulting from their meningitis. And many other patients can actually have long-term morbidity and mortality in terms of neurological consequences. So again, when we're talking about a central nervous system, which is kind of the brains, no pun intended, of our entire body, you want to be really careful, because an infection in that particular organ system can really have devastating long-term consequences. I think one thing that the COVID-19 pandemic has really taught us is that prevention and vaccination are the keys to really living healthy, happy lives. And the good thing is, with meningitis, we do have some vaccines that are available. They're usually recommended for preteens or teens by the CDC. But for certain high-risk adults or adults who may not have been vaccinated, it is important to talk to your doctor as well and see if you may need to get a booster shot, or you may need to restart the vaccination series. And the ones that are particularly high risk, certainly, college going kids should be vaccinated because they live in close proximity, in close quarters with each other. Military recruits, because of the similar sort of living circumstances, in prisons and crowded living facilities, if you're living in a crowded apartment building or what have you, or anyone else who might be at increased risk of exposure because of their occupation, they should certainly talk to their doctors about whether a repeat booster is necessary. But make sure you get your kids vaccinated in that early period, because again, it's such a devastating illness with such a high morbidity and mortality that if you can prevent it with vaccination, that's helpful. Now, keep in mind, the vaccination is only against some subset of bacterial strains, so it may not be effective at some of the other types of meningitis, but it does protect you from some of the organisms that can cause meningitis. I also want to remind everybody that meningitis really, it's the most vulnerable populations are the extremes of age, so very little babies because their immune system is naive, and also, the elderly because their immune system is weak or tired. But we also can see meningitis rear its ugly head in pregnant women, or patients who are getting treated for cancer or otherwise immunosuppressed because of HIV. So if you have any of those risk factors, or have, patients or family members with those risk factors, just again, have a higher, suspicion for any sort of concerning clinical symptoms that could be consistent with meningitis.